Today, we are involved in surveillance in various ways. We surveil or monitor our children, our spouse, our property. Employers watch over workers. Police watch over neighborhoods. Guards watch over prisoners, and so on. Facebook is another way of monitoring the activities of our friends, and this is a form of surveillance. Therefore, surveillance is a way of life. Literally, surveillance means to watch over. In most instances, however, surveillance has a more specific usage. Agricultural experts may carry out aerial surveillance of crops, intelligence officers may put suspects under observation, or public health officials may conduct disease surveillance to monitor outbreaks or epidemics. The purpose to any of these surveillance activities is to gather information that could be used to guide decision or action. We are living in a culture of surveillance, watching as a way of life. Let me focus now on public health surveillance. During the COVID-19 pandemic, physicians use stethoscope, X-ray, CT scan to assess the clinical condition of the patient, whereas public health practitioners use surveillance to assess the epidemic situation in the population. This includes obtaining basic information on the number of people who were sick of COVID on a weekly basis, risk factors for COVID infection and death, such as age, sex, occupation, and others, and the incidence of COVID in identified geographic locations. This comprised the basic surveillance information summarized as time, person, and place. Most public health surveillance systems were developed to monitor infectious diseases that have the potential to cause outbreaks or epidemics. Today, public health surveillance utility has extended to monitor non-infectious diseases and behaviors like hypertension, diabetes, obesity, smoking, condom use, etc. In layman's terms, surveillance is the eyes and ears of public health, whose aim is to assess the health situation of the community so that appropriate actions can be made. The World Health Organization defines public health surveillance as the continuous, systematic collection, analysis, and interpretation of health-related data needed for the planning, implementation, and evaluation of public health practice. In short, this definition means health information for action. In some cases, actions must be immediate, within hours, in order to prevent large-scale epidemics and deaths, for instance, from cholera, meningitis, Ebola, or food contamination. In others, action may be taken within weeks, months, or even years, such as in the prevention and control of tuberculosis, AIDS, malaria, and non-communicable diseases such as diabetes and hypertension. Therefore, action or response is what distinguishes surveillance from the task of simply monitoring events. Without action, public health surveillance is dead. In our next video, we will discuss in detail the definition of public health surveillance. There are two core objectives for public health surveillance. One is to detect epidemics, and the second is to monitor the progress of public health programs. Therefore, national and local government units without a strong public health surveillance system will lack the ability to monitor disease patterns and be unable to plan and mobilize the scale of response required to contain an outbreak or pandemic. An example to this is the devastating COVID-19 pandemic that has uncovered weak surveillance systems in many countries. If we want to avoid another pandemic of similar impact, we need to build the kind of public health surveillance and capabilities that give us early insight into our emerging threats to stop them before they can destroy the world. We invest in ways to alert us to impending threats like military reconnaissance, fire alarms, and even insurance because we perceive the risk of a disaster happening at some point. We need to have the same approach to epidemic or pandemic threats. This is a moment in which we really have a chance to change the future. It's not too late to invest and fix our public health surveillance systems.